Okay, all right, we're starting.
It's time to get that arthritis out. Time to get a new hip. Everything will be fine, right?
I can hardly function doing some things.
And we make a lesion in the brain to disrupt the tremor-causing circuit.
All my memories went black, and I don't remember anything for a couple days after that.
It's treating from the inside out, and the dose falls off very quickly.
I thought I would wake up and my husband would be dead.
There were no other options except heart transplant.
Right now we're cutting out the heart. Look at that thing. Ooh, big.
Es un grito de alegría, de vida, de oportunidad.
My life changed overnight. In 1989, I was hit by a drunk driver on a 85-mile-per-hour head-on collision, and I've had 24 surgeries. This will be my 25th surgery. Arthritis has set in really bad.
A fall or a car accident which causes an overload to a joint, which leads to the cartilage thinning out. The only thing left is bone of the ball and bone of the cup to articulate with one another, which is essentially like walking on a grindstone.
And I know she's in pain every single day. She refuses to take pain medication. She only takes it very, very rarely. And that's when I'm like, Mom, you have to take something.
So it's time to get that arthritis out. Time to get a new hip.
So, right hip?
Right hip.
Okay. And we ready to take care of this tomorrow?
I'm ready. I am waiting. I'm very excited.
We're doing total hip replacement, which means we're replacing both the cup and the ball.
Go ahead and have a seat, and the nurses
thanks.
will be right up for you, okay?
This is it. I'm going to be out of pain, and I'm going to be walking normal, and the doc is going to put me back together, and I'm going to get the newest of hips, and I'm very excited about it. Hi. Love you, honey. Everything will be fine. Okay, I know it will. I know, I'm in good hands. Oh, I am very excited. I am. I'm very happy.
Okay, we'll get you all taken care of, okay?
Thank you. I am.
Right.
Thanks.
I'll swing you around here and back into the room.
Oh, okay.
All right, Nancy, just give me some slow, deep breaths. All we need you to do is just think nice, positive thoughts and think of all the new things you're going to be doing with your new hip. You're going to take great care of it.
Through integrating technology with advanced anesthetic techniques and the most recent evidence-based guidelines, we're able to transform what was once a major operation where patients would be in the hospital for 4 or 5 days, sometimes even up to a week, into an outpatient surgery where patients are going home even on the same day. 1, 2, 3.
Okay, yep, she's here for a right primary total hip arthroplasty. Case should take about an hour. Blood loss will be probably 50 to 75 cc's. Okay, all right, we're starting. Small approach, it's about 6 or 7 centimeters, okay? And it's kind of in the flexion crease of the hip. So this is what we call a bikini approach, Southern California. So it's one of the more...
On a 73-year-old, okay.
Yeah. One of the more cosmetic approaches, but moreover, I like it because it has kind of one of the lowest risks of any wound issues.
Okay.
Ball comes off, and you get a geometric cut right here, where we take off the neck of the bone, and that gives us the ability to put this stem down here, which is again made of titanium. And then you get a new titanium cup in here. And then this liner is again made of plastic, and that locks into the cup. Okay, pretty good fit. Let's check stability. Posterior, no impingement here. Okay, all right, good.
Oh, yeah, I'm waking up and, oh, wow. I can't believe I just had the surgery a few hours ago.
I know.
mean, this is like
crazy
a
how
miracle.
fast you get up and move, huh?
Okay.
Okay.
Okay. Look at that. And oh my gosh, I walked in and here, surgery was just a few hours ago.
Yeah, you're doing wonderful. Yeah.
Is this unbelievable? Oh.
How you feeling?
I'm just getting a little tired, but I walked.
Good, how'd it feel?
Pete, feel fine.
Good.
I mean, I'm just like, I can't believe it.
I'm very happy to hear that. Everything went excellent. You had very bad arthritis in there, as you can imagine.
It was really bad.
Yeah, bone on bone. So,
Ooh.
yep. So, brand new hip, cup and ball. Everything went perfect. Closed up very beautifully, like I said.
Wow.
A nice Southern California closure. All right.
Oh,
Like I said, everything went
thank
great.
you.
Yep.
Thank you. I'm in awe.
For mom, being able to be in her own bed, her own space, not in a hospital where she's having to be checked on all night long, not getting a good night's sleep. It was home, it was comfortable, and no complications whatsoever.
Hi, Nancy.
Hello, I'm ready.
Good, good. I'm ready for you. I have no doubts Nancy's going to be able to do whatever she wants to do. The game plan is getting her glutes stronger, especially in positions where her foot's on the ground. Very nice. The goal today was also just to incorporate a little bit of balance, having her do some of that weight shifting and tapping. When you can kind of see the light at the end of the tunnel, you really start moving and making progress.
It's healing wonderful. This is 5 weeks, and look at me.
Sky's the limit for Nancy.
Give me a hug. You've been great. I love it. I love it. You've been fabulous.
All right, Nancy, keep up the good work.
I wouldn't be walking if it wasn't for you.
Can you tell me what's wrong with the patient?
Strokes are basically brain heart attacks. Every minute that goes by, more and more of those brain neurons can die.
This is a 51-year-old female who arrived to us.
We've been using telemedicine since 2016. We were actually one of the first in Sharp Healthcare to use telemedicine for stroke care. It's really amenable to the exam for a stroke patient.
The fact that now that Coronado on Island is capable of dealing with this, those patients no longer need to go over the bridge.
Time is tissue, so every minute that we delay care, we lose 2 million brain cells.
The moment they hit the door, they have access to both the excellent care at Coronado, but also the resources that are available at the Neuroscience Hospital at Sharp-Grossmont Hospital campus.
The great part is that you have a nurse at bedside that's the extension of the neurologist, and we are assisting with the exam, making the patient feel comfortable, assisting with lifting the arms and the legs, whatever the neurologist asks of us. We are the healing touch piece of that exam, and we make it more human.
We are embracing cutting-edge technology that really makes the greatest difference in patients with neurological diseases.
This tremor started approximately 15 years ago. Unfortunately, over the years, it's gotten worse. Now, I can hardly function doing some things.
Her tremor is really when she's eating and drinking and especially holding heavier objects. This procedure is based on how can we target ultrasound energy to a very focal point and cause an increase in temperature in the brain to the point where we cause a lesion. Maybe about a pea-sized is kind of what I tell most of my patients. As we mentioned, there's no knife, no incision. We're really using focused ultrasound waves to go through. And we make a lesion in the brain to disrupt the tremor-causing circuit.
The big day is tomorrow, and I'm just about to leave to go to my hair salon and have my head shaved. It's hair, it'll grow, or maybe I'll just love it and embrace it.
We are the only ones in San Diego providing focused ultrasound. Having such a short procedure time and being able to see the really quick results is amazing.
Morning of procedure, you come in, we shave the head basically, and this is the cleanest shave you'll ever have, and that's because hair blocks the sound energy from getting through. We start with the placement of the frame or the head holder.
That looks good, so we're just kind of lining it up. Okay.
We walk you over to the MRI, and then what we do is we actually put the helmet over your head, and we fill all of this with water. So it's cold water, and the cold water is actually what lets the ultrasound energy go from the actual helmet and the transducer through the scalp and bone and to the brain itself. We are going to go ahead and identify our target. Since we're treating her right hand, we actually have to make a lesion in the left thalamus, or the left side of the brain. So we'll start with about 2,500 joules, which we're gonna deliver to her. And that sound is the energy being delivered as we speak. This green line shows that we are delivering all the energy that we want to deliver at the moment. This green dot was my target. And as I go up in temperature, I can tell we are really tightly focused. Things are looking good. Hey, Sandy, everything looks great. All right, so I'm pretty happy with everything. That hand is looking great. Pop it up for me all the way straight up. Stevie's gonna give you that water bottle. Go ahead, hold that up for me. Good, now slowly bring it back towards your mouth. Good. Hold it right there. Hold it right there. Hold it right there. Hold it right there. All right. Put it back all the way up. Fantastic, that's looking good. Move your head to your chin. Side.
Look at you. Look at you. Cute.
I'm not shaking, rattling, and rolling anymore.
Good.
Look.
Dynamite.
After the focus ultrasound procedure, we celebrate with our patients. They complete their last spiral drawing and show off their new writing skills. We open a bottle of apple juice and toast for celebration.
Cheers.
Cheers.
To life.
Very nice. Ready for those
The
peas?
first time in years that I can actually hold a glass and drink without shaking. It's there's no words. Yeah, yep.
Code ECMO, Sharp Memorial Hospital.
I recall first asking them, where am I?
A patient that is dead, a patient that has already failed all the CPR types of methods, all the shocking, all the putting of breathing tubes down. This is a device that we can use when patients have less than 1% chance of survival.
ECMO is extracorporeal membrane oxygenation. It's the use of a machine to remove blood from the body, oxygenate it, and put it back into the body.
September of 2019, I do remember pulling into the ambulance bay at the emergency room at Sharp Memorial, but after that, all my memories went black and I don't remember anything for a couple days after that, when I actually arrested a couple times, and that's when they had to make the considerations for ECMO at that time. The first thing my family said that came out of my mouth was, where am I? And when they told me where I was, my response was, oh, thank God. This is my home, this is where I work, this is the people that I trust.
How are you feeling today?
Good, doctor. Doing pretty good.
So I've been so fortunate to not only be one of their patients, but to also just learn more about it through them.
1, 2, 3.
ECMO is done in the emergency room, it's done in the operating rooms. It doesn't happen where women are birthing their children. So we didn't have an idea that Alyssa was gonna need this. It was very sudden.
I took off work 3 weeks before my due date. I don't remember the couple days before my induction, and I don't remember the whole week after.
It all happened. It was a second long. I mean, things were normal and then they weren't almost immediately.
The one thing that I've feared my entire career is an amniotic fluid embolism, so I'm already thinking that's probably what it is.
Typically, patients with amniotic fluid embolism have we call cardiopulmonary collapse. She was not going to recover with simply CPR.
I saw this patient laying next to the operating table, purple.
She's still pregnant with baby. Your biggest concern is, I need to get this baby out now.
Every time we stopped compressions to check her pulse, she would begin to crash again. So when ECMO came, it was like the cavalry had arrived.
Everyone delivered that baby girl so quickly and safely, and then was then able to dedicate all of their efforts to focusing on saving Alyssa's life.
Often people think of ECMO as a miracle machine, but it really isn't a miracle machine. It provides us the time needed to implement therapies to make people better, to go live lives.
Being in the right place at the right time was what determined my survival and my baby's survival.
It saved me. If it wasn't for ECMO, I would 100% not be here. I would not be alive.
Hi, honey baby. Look at your mama.
En un mes llegué a terminar esto, a tener otra oportunidad de vida. Un mes.
procedure is basically the radiotherapy that we need after we do the lumpectomies for breast cancer. The difference is that this is a localized kind of radiation. Instead of the whole breast, it's localized to the area where you did the surgery. Hello? ¿Cómo está, señora? ¿Toda tranquilita? ¿Lista?
It's a way of delivering partial breast radiation where we just target the radiation to the main area where the tumor was, which allows less total radiation dose to the heart, to the lungs, and to the rest of the breast.
This is a device we're going to insert in the cavity. So this portion is going to be in the cavity where the tumor was. When you expand the catheter, it takes up the space where the tumor was and it gets the radiation just to the cavity. ¿Está bien, verdad? Sí. Bueno, ya sabe, un poquito de Tylenol y un poquito de antibiótico que le voy a mandar a su farmacia. ¿Ok? Gracias. Listo.
The benefit of Savvy is that it allows for a very quick treatment for patients. They get done in less than a week. And for Ada, she was able to be done just within a couple days of having the device put in. It allows a very focused treatment just to the area where the radiation is most needed, the tumor bed where the initial breast cancer was that was removed at surgery.
Savvy stands for strut adjusted volume implant. The radioactive source is going to come down these straws or struts, and it's going to stop, deliver radiation, pull back, stop, deliver radiation, and by position and time, it actually will shape the radiation. It's treating from the inside out, and the dose falls off very quickly. This is 100% of the dose coverage, and then as you go away, it decreases real rapidly. 1.5 centimeters, it's down to like 50%. She is in the room, and all she'll hear is the little motor with a little whine, and it's retracting, stop, retract, stop, so she'll just hear that click. Previous radiation therapy used to go from the entire breast being treated to an accelerated breast protocol where it was 10 fractions over 5 days, and now we have the ability to do 3 fractions over 2 days. Finished! Yay! She did great. We're just going to disconnect the catheters now.
Ahora sí dijiste llorando.
You made her cry. But she's kidding.
Es un grito de alegría, de vida, de oportunidad. Se te mueve el piso. Pero la familia, por la familia sales adelante.
I'm thinking, how much time do I have left? That's what I'm thinking, you know, because there was no cure for it.
I thought he would die in his sleep, honestly. I thought I would wake up and my husband would be dead next to me. Yeah.
I kind of knew that we had to dig deep, and we did more tests, and I think we came to the realization that the time had come for Vernal to get a heart transplant.
There were no other options except heart transplant, because that's what is considered a cure for the disease.
Amyloid is a protein that we all have in our body, but when it deposits in the heart, it makes the heart very stiff, very thick, very restricted, and subsequently can't pump and send blood out to the body efficiently.
I was like, oh, okay. You know, it wasn't a good thing, you know.
It's very scary when you hear the news that there is a heart waiting for you. Most patients see their mortality at that time because they understand that a beating piece of their own body, their heart, is going to be removed from them and a new one's going to be put in.
You know, the one thing that you think about, somebody had to die. You know. And you're grateful to have a second chance, but somebody had to die.
But we thank him or her, or whoever it is, for their generosity, and we pray for their family. But that is hard. You got to take care of that heart.
How are you?
All right.
All right, so things look good. The heart looks good in the field, so we're gonna get you back into the operating room, get things moving along here, okay? All right, man, I got you.
Many years ago, one of our patients was gifted a disco ball from someone in her family, and she put it on her IV pole, and she would walk the unit trying to get her strength up for her heart transplant. After surgery, she passed it on to the next patient waiting for a heart in the ICU, and it became part of the ritual of a heart transplant.
Love you.
Today we're doing Vernal's heart transplant. Right now we have one of our other surgeons, Dr. Hassaneen's out in the field. He's assessed the heart and he's in the air bringing the heart back for transplant.
By Dr. Limmer for a orthotopic heart transplant on cardiopulmonary bypass under general anesthesia.
Let's do it. All right. Put the lungs down, please. Okay, Dr. Hassaneen got back with the heart, so we're gonna put the clamp on and do the cardiectomy, okay? Okay, so right now we're cutting out the heart. We're opening the right atrium. We've already divided the aorta. Okay, here's the heart. Look at that thing. Ooh, big. Okay, 11 blade, please.
Sorry, sir.
All right, bring it up. Okay. I got a cold lap and size. Okay, first stitch. All right, right now we're sewing in the left atrium. And now we're sewing the pulmonary artery in. The last step's gonna be to connect the aorta, and then we'll take the cross clamp off and see how the heart's working. Take off the clamp. Go ahead, pumps down. Everything looks pretty good. Heart's functioning well. All right, everything looks good.
Yes, Marie, that was the important call came in?
Yeah, I mean, I'm calling from the hospital right now. Great news. I just spoke with the doctor. He's all closed up, heart's in, and we're just waiting for him to come downstairs. So,
They fit it already?
yes.
I pray for you all the time, Marie, all the time.
Thank you.
And I thank God for you for being a good wife to my son. You don't know how it means to me.
Thank you.
I wasn't able to be there for my child, and you were there for him. It's a blessing. Thank you, Marie. Thank you, Pete, for taking care of my child for me. Thank you, thank you. I appreciate it. Thank you so much.
Thank you.
I'll show you his x-ray. It looks really good today. Progressing well.
Friday, I got a heart. Now it's Monday. But I just know it's like a miracle, man.
It is.
It's like something
It is.
you don't know until you go through it. You can't explain it to somebody.
Yeah.
Okay.
So it's like it freaks me out.
Yeah.
It's real now.
I could feel myself coming back
Coming out of the fog a little bit.
from what I had when you told me you knew this day was going to come.
Yeah.
And now I feel totally different than that.
Now the day has come and passed, right?
Like, how many months you think it's gonna take before me to get out in public with my wife, Go to a restaurant, like 3 months.
Probably earlier than that.
Okay, good. Okay. That's what I wanna do, Go to a nice restaurant with her for that first time. Cause she do a lot.
We're all happy to be here.
Are you a millionaire? Yeah.
One of the things that is very unique here that we offer is that we allow our heart transplant patients to actually see their heart. It allows patients to have really nice closure and also understanding of why exactly they needed a heart transplant in a very physical, realistic thing that they can touch and feel and see.
Here's a normal heart. As you can see, we kind of say it's the size of our fist.
Right.
All right, and then now I'm going to show you yours, okay? Wow.
Wow.
Oh my. Crazy. So don't touch it yet because you got to put on gloves.
Okay.
But as you can see, it's very large. And look at these walls. How thick. Very, very thick walls. And that's due to your amyloidosis. Just be careful with that, okay? Yeah, they can kind of fall apart.
That's really thick.
Yeah. It is, yeah.
Sorry the body had to work against you, but you did a good job. You see the normal heart, and you see my heart, and what it had to go through. It's a miracle it got me this far. Because I was at the end, you know? And it just kept pumping. It wasn't going fast, but it kept pumping, kept pumping.
We stand here today to honor the miracle of organ donation and transplant. As a symbol, we would like to have you tie a ribbon on the tree of life and ring the bell. Congratulations on this valuable gift.
You know, to be where I was and where I'm at now, you saw the way I was before. Look, I have color in my face now. You know, I feel like I felt before I had the condition. I'm getting back to what I used to be. And you can't beat that. I'm blessed to be here.
Healthcare is really unique. It allows us to not only physically, but emotionally reach a person.
At the end of the day, we have all the technology at our disposal, but without the care that we're able to provide here, we would not have the end results that we want.
Gracias por acompañarnos en esto.
We're here to celebrate with you. We're here to grieve with you. We take care of your loved ones while you're unable to, and we take care of you if your family's not able to.
If you listen to a patient and really hear what they're saying and really try to tailor what you do to that specific patient's needs, guaranteed patients are going to do better and have a much, much better recovery and experience.
So how are we going to do it? Like punky?
Yes, more like punk.
Okay. I can't believe it's been 4 months and now I have more hair than you.
Yeah, and you're rocking that short hair.
We want to provide the care that we would want our family to have to enable patients and people to get back to their lives.
Look at a nice little pizza there.
Yeah.
Look at that one. Now that's nice.
That one.
That's nice.
It's almost 40 years. I think we're over that.
I love being here with you.
I love being here with you as well.